Hello everyone, I'm Garrett, and today for the next 5 minutes I'm going to be talking to you about PTSD, or post-traumatic stress disorder. In the Diagnostic and Statistical Manual of Mental Disorders, written by the American Psychiatric Association, it's described as an anxiety disorder caused by witnessing, confronting, or experiencing an event or events that involve actual or threatened death or serious injury to oneself or others. In the past, it has been called shell shock, battle fatigue, railway spine, stress syndrome, and traumatic war neurosis. There are many different causes of PTSD, such as earthquakes, tornadoes, hurricanes, tsunamis, floods, and different types of abuses such as physical abuse, domestic abuse, child abuse, rape and molestation, and also house fires and car crashes. But one of the main and most popular reasons for PTSD lately has been war and terrorism. 15 and 19% of returning vets showed PTSD symptoms, and following up today, or over the last few years, 42% have showed symptoms of PTSD. There are many different symptoms of this, such as a re-experiencing of the event, having recurrent, intrusive, distressing recollections of it, having recurrent nightmares, and a sense of reliving it over and over through hallucinations and flashbacks. There is also an intense psychological distress when exposed to certain cues that resemble the event. For example, when I was stationed in North Carolina, I had a sergeant that just got back from Iraq, and when we were marching in the chow hall, there was a air pressure release valve on a building close by, and when that went off, he hit the deck because he thought he was being fired at with an RPG. So for that second, he thought he was back in there from a sound. And there's also emotional numbing, which is avoiding thoughts, feelings, and conversations about the event. And avoiding places and people that arouse events or memories, and an overall feeling of detachment from society because no one knows what they've been through and no one knows what they've seen, a feeling of that. And there's also increased arousal and difficulty falling asleep, staying asleep, because they're always alert, always looking out for different threats. And outbursts of anger and violence are also common. And this is not mandatory, but also shows up a lot, is a survivor guilt, feeling of why wasn't I taken, why wasn't it me instead of my friends. And there are also different treatments for PTSD, such as cognitive behavioral therapy, which is done with a therapist to help them understand and change their thinking about the trauma that they went through, and to learn how to cope with anger, fear, and guilt of the trauma. And there's also exposure therapy, where they talk about what they've been through while learning how to relax and desensitize themselves from it. They also can go to support groups, which is around other people that have been through that. And there's different drugs that they can take, such as antidepressants and sleep medications. But they are just to control symptoms of PTSD, they don't cure it. And so today I told you what PTSD is, what causes it, the symptoms, and the treatment. Thank you for your time.